So, I wanted to share some things that took place during the euthanasia process, um, wherein my cat Sindel crossed the Rainbow Bridge on the 12th that were new and unique to me, having gone through this process several times before, that I think would be valuable and comforting to people that either A, have never euthanized a pet, and or B, have never experienced this particular thing whilst euthanizing a pet. Trigger warning, I'm going to be talking about some potentially uncomfortable details about the physiological goings on when a pet, specifically a cat, passes. Brief context, my cat was 15 and a half years old when she was diagnosed unexpectedly out of nowhere, having just had pristine blood work come back with osteosarcoma. Basically, she had bone cancer of her maxilla, so her eye socket and her upper jaw. In addition to that, she had a tumor behind said eye. And within about 72 hours of the diagnosis, she did go blind in both eyes overnight. But my brave girl was completely unfazed by going blind. You wouldn't even know. And thanks to mutual aid, the literal generosity of strangers, I was able to afford her end-of-life palliative care, her euthanasia, and her cremation. I say all of this to say that prior to my Sindel's crossing on the 12th of this month, I had already euthanized 3 of my cats, and so was very well prepared for what to expect. The process is comprised of 2 injections. The first is a heavy sedative, which allows them to relax completely. They can be in and out of consciousness, but they are in no pain. They are completely relaxed. The second injection will come a few minutes later, and that is the lethal dose that starts to shut down their organs, very specifically their lungs, their respiratory system, and their heart. At which point, within a few seconds to a few moments, they have crossed. So here's where the difference comes in. In my previous 3 experiences, when the doctor injected the second dose, the lethal dose, it was instant. Like, you could see the light go out in their eyes. Like, their pupils will dilate, and you can see them go. It's very clear. Breathing stops, heart stops. Particularly unsettling and unexpected and jarring, but not at all uncommon with what I experienced with Sindel's passing. The first injection was fine, normal, business as usual. But because she had a little bit of a belly, I was keeping the calories on her. The doctor was not able to inject the lethal dose directly into the kidney, so it was taking a few minutes rather than a few seconds to a minute for her systems to shut down. So if you've ever had a loved one pass and have experienced or been present for their agonal breathing, not synonymous with agony. Agonal breathing is an involuntary reflex that takes place when the systems are shutting down. So it can sound like wheezing, gurgling, sometimes choking. Humans and animals are not conscious for this. They're not experiencing pain. It is not a sign of distress. It is an involuntary reflex because the body is so relaxed. But when you hear it, it can still be very distressing. So because it was taking a little bit longer than anyone would prefer, even though she was not conscious and not in any pain or distress, the doctor administered a second dose intravenously. And the jarring part of that was that when she was in my arms, her breathing had stopped, but her heart was still going. It was strong. My baby's heart was strong. And I wasn't expecting that. I was expecting everything to shut down at the same time. But I was reassured that this can happen and it is normal. And a minute or two passed, and then the doctor came back in and checked, and the heart had stopped as well, and my baby had crossed. But I had never experienced anything again like this. But I want to assure you that if you have a similar experience, to not be distressed, to remain calm. Your baby needs you to be calm. Your baby needs you to talk to them, hold them, pet them. It's all part of the process. It's all part of a very natural process. Sometimes the breathing stops first, sometimes the heart stops first. Either way, they're not in pain, they're not in distress. If you should encounter, an experience that is not what you anticipated, do not hesitate to ask questions to your vet, and in fact make sure that you do, because in the event that something is not right, you as their parent will intuit that, and you need to be able to use your voice and say, hey, is this normal? Is this okay? So even up until the end, advocate for your baby. If something doesn't feel right, there is a possibility that something is not right. So raise your hand, ask a question. 9 times out of 10, everything is completely normal. And it's you that's in distress. It's you that's in pain. And your baby is absolutely fine. The body is shutting down the way that body needs to shut down. But I thought I would share my experience in hopes that it might assuage your concerns or your fears, and encourage you to just communicate with your doctor, because it's not an easy process, but it is a natural process. And that's it. Thank you guys.